Hello and welcome to today's episode of Science Club Daily. I'm Ross Balch and today I'm being joined by Tina. Hello.
Hi, and today we shall be talking about #flatten the curve.
Yeah, so we have a much bigger video that goes into a lot of detail about coronavirus that you can watch, and that'll be uploaded today as well. But we really wanted to get a video that's all about flattening the curve and why that's important. So do you want to kind of explain the graph that we have up on the screen here?
Absolutely. So you probably would have seen this infographic spread around Facebook and social media, and it is probably the most important infographic we have now.
Yeah.
So if we have a look at a graph, we can see two curves, and then on the y-axis, which is the one that's going vertical, that's the number of cases. And then at the bottom is time, I believe, yes.
Yeah.
So time since the first curve. So what that's saying is, in the first curve is the condition that happens as a new pandemic occurs, right? So there's a shoot up in the number of cases over a short period of time. And what we are trying to do is sort of flatten the curve. So we are trying to get a spread of cases over a longer period of time. Now, why is it important to actually to flatten the curve, essentially?
Yeah.
So if you've noticed, there's a little dotted line that goes across the graph. Now, that is the important line here. That is the capacity of your local healthcare.
Yeah.
And why that's important is that the biggest issue now, we've talked about in the episode, there was a 6% fatality rate of the disease.
Yeah.
And a lot of that is actually due to a denial of access, essentially. So what that means is that just say 1,000 people walk into the hospital, right? All of them presenting with the same symptoms. Now, in the hospital, there's only 200 beds in the emergency department. So not everybody is actually going to get a bed, right? So healthcare professionals at that moment had to make a tough decision, or who gets the bed and who doesn't.
Yeah.
And those who don't get the bed, unfortunately, end up dying as well. Yeah. So what we are trying to do is to prevent the amount of cases. Well, we can't prevent the cases outright. We can just reduce the number that's utilizing the healthcare system at the same amount of time.
Yeah.
Right.
So essentially, instead of, within, say, a month, half of the population of Australia getting infected, and at some point, some of those will need hospital care. If that happens, we just won't have the number of beds, respirators, drugs, even just the ability to test, like having enough swabs and that kind of thing. So what we need to do is essentially flatten the curve. It's what it sounds like. We have to do things that will help stop the spread of the disease to the point where the hospital is never overwhelmed. That the actual infection, of the virus, the actual course in society, instead of taking a month, maybe it takes a year. And I know to some people that actually sounds worse. Why would you want the virus to be around for a year when we could get it over with? But it's this idea of that the more cases we have, the less likely our hospitals are to be able to deal with them all. And so there are quite a few things that we need to do. And I think at the moment as well, a lot of people don't see these social isolation measures as being important because we don't have that many cases. And a lot of people will say, well, the fatality rate is only 2%. It's mostly elderly people and immunocompromised people who get sick. But the point is that those people are important and we need to try our best to make sure those people don't get infected. And then if they do, we need to make sure that as few are infected at once so that the hospital system can actually handle this and not get overwhelmed and therefore cause a lot more deaths by lack of resources compared to, just the course of the disease itself, which, like some people are still going to die, unfortunately, because even the best healthcare in the worst cases wouldn't save them, but we still need to give them the best fighting chance they have. So let's talk a little bit about all of the things that you can do in order to help this. So the first one is the hand hygiene, really important. Wash with soap thoroughly, and 20 seconds is the minimum, and there are a lot of good online resources for sort of songs that you can sing to yourself.
Yeah, so most of you would have noticed these diagrams that have, I believe it's 10 steps or 8 steps of how the different motions that you have to go through when washing your hands. And then they have attached like little 20-second song lyrics to go along with it just to help you keep time. Yeah. Now, it's important to actually follow those diagrams because, it's not just as simple as just washing your hand like this. A lot of people tend to forget getting into the little creases between your fingers, the ends of your nails and things like that. So it has to be 20 seconds and it has to be comprehensive to give you the best chance of eliminating the virus.
That's right.
And I guess another thing that we should talk about as well is why soap, really? Like a lot of people seem skeptical that soap actually is capable of destroying the virus. And there is actually scientific grounds to that, right?
Yeah.
So soap basically reacts to lipids or fats.
Yeah.
And viruses, the capsule of viruses, are actually composed of those fats. So what you're doing essentially by applying soap on it, you're stripping its protective layer on the top.
Exactly.
And it literally just bursts the virus essentially, and that's how you destroy it. So try not to be skeptical of that. It is actually scientifically sound, and just go for it. What is not scientifically sound, however, is people promoting you to get antibacterial soap, because that's antibacterial, it's not antiviral.
Yeah, the compounds in antibacterials are actually designed to kill bacteria that have much different physiology, I guess, than viruses. And a lot of the time, it's chemicals that are more like drugs than they are like the physical action of soap breaking open viruses. And the other thing we can talk about, of course, is infection etiquette. So even if you're not currently sick, and this is, to be fair, stuff you should already be doing anyway, if you have to cough into a tissue, if you don't have that at hand, you can cough into your elbow, almost like a dab. You can sort of,
you can just sort of dab it.
Or if and at an absolute, and I mean absolute emergency, you can cough sort of into your collar, and that will help a little bit to sort of stop the spread of things like the fomites, the droplets that have the virus in them.
Exactly. And then the other thing is social distancing, which is an important one. So we've been advised to have a distance of, I believe it is 1.5 meters between the next individual.
Yeah.
And that is essentially able to avoid the spread of the aerosols, or the fomites in this case, from actually getting in touch with you. So, it sounds something, it's difficult to actually do this, especially if you're sitting in confined spaces like a public transport or a lecture theater or something like that. But, every other time where this is available, you should always be keeping that 1.5 meter distance as you can.
And honestly, this is going to mean making some tough sacrifices. Things like social sport should probably be suspended, because that's a really good way of spreading the virus around. Do you need to have a barbecue at your friend's house this weekend? Honestly, you have to ask yourself that, because it might be better that you stay apart. Maybe you can try something different, like Discord parties or something,
Exactly.
Viewing parties online. Schools, universities, they're starting to close now. I think UQ, is going
for 1
online,
week.
and QUT as well. A lot of universities are going to online now. It's really important that you limit social interactions to literally the bare minimum that you need, which is going to be hard, but it's going to be really important. And I know a lot of people are going to say that it's kind of overboard. And what we're hoping is that at the end of this, it seems like it was, because people, not too many people died and not too many people got infected. And if that's the case, then all of this will have worked. And that's the important thing. So today is the time to start, not next week, not when it starts to seem bad. Today is the day to actually start the social distancing, just reducing social interaction as much as possible, just to literally, because you might have the virus and not even know. And it would be awful if you were to infect your grandma or a friend who's immunocompromised, or even just another friend who then goes on to infect someone who's vulnerable. So it's really important that we all actually do these measures, and as soon as possible. And the other one that I want to talk about is the flu vaccine. Now, obviously, the flu vaccine itself will not protect anyone from coronavirus, because it's a vaccine for the flu. But the fact is that in Australia, especially right now, we are going into the flu season, and the flu itself actually can be quite a burden on the healthcare. And what we don't want is for the flu season and the coronavirus to come together at the same time. Because, you go back to this curve. So this is the coronavirus curve. Imagine adding the flu virus on top of that.
Yeah, it's going to at least double in height, really.
It really will have a big effect. So if you can get the flu vaccine this year, get it early, maybe get it twice, maybe get it now, because the flu vaccine tends to come out early April, mid-April. Get it again in June or July, just to make sure that you are definitely covered for the flu vaccine. And that will help flatten the curve massively. And I think the other one is just human decency, being kind to each other, thinking about other people, and not just yourself. That just because you might be fine if you catch the virus doesn't mean it's not a massive deal to someone else who, either because they're in a risk group or because they couldn't get the right healthcare, even just indirectly, if resources are going to coronavirus, that means resources for other health matters aren't available. And so we just need to think about each other more than anything right now.
Love thy neighbor. That's a good piece of advice to practice right now.